So welcome back to Morning Break. It is National Men's Health Week, and staying healthy means different things to different men depending on where they are in their life. Dr. Keith Cobb is a board-certified internal medicine physician with SouthCoast Health. He's here this morning to outline what men of different ages should be paying attention to this week and really all the time. Good morning. How are you, Doctor?
Good morning, Tim. Thank you for having me.
Appreciate you being here. Men, they kind of get the knock of they don't pay enough attention to their health. Hopefully this week is designed to change that.
It is. And at one point in my career years ago, I would ask men why you're here today, and they say, because my wife sent me.
Yeah.
I think that's changing, and men are becoming more engaged in their health and willing to come in and have a physical. And you're right, at different ages, different things we need to look at. So let's say our younger men, and I'll give you a rough age of 20 to 40. So these are men that we're really looking at lifestyle, weight, and looking at your family history, right. And what do you need to be looking at your age so you prevent these problems. As far as testicular cancer, that's a young man's disease and occurs in about 1 out of 300 and close to 100% cure rate. And so there are several conditions like that that we could cure if we can catch them early. And I am seeing more young men who come in who are willing to have their annual physical done. Young ages, all ages, but young ages has particular challenges, trying to buy a home, trying to raise a family, and those are things that we're willing to talk about and see can we help with handling that stress. Then we'll look at, say, 40 to 65, the middle age group. So we're looking at conditions that may present at that point in someone's life: hypertension, high cholesterol, risk factors for heart disease and stroke. And as we do that, we want to treat that while we can. And cancer screening.
And that's an age group where people's bodies have probably changed.
Exactly.
So they probably have to pay a little bit more attention to things associated with that.
That's exactly right. And back to the younger age group, we're talking about basically a weight velocity on a chart. Right. And if you're seeing that going up as a young man, you're probably going to be heavier in your middle age and increase your risk factors for heart disease, hypertension, and things like that. So cancer screening in that age group is going to be prostate cancer, colon cancer, skin cancer, things like that. Vaccinations. And then as we go into the older age group, 65 and older, and that age group is changing because we're seeing a lot of patients in their 90s, so that older group is not quite so old at age 65 as we used to call it. But fall risk precautions, and the most common reason for hip fractures and surgeries in our older individuals are falls in the home. So if you have not thought about it, handrails, guardrails in your shower and in your tub. Think about the fall rugs in your home, risk factors for fall, and that is throw rugs in your home. Think about those. And again, vaccinations, so shingles vaccine, pneumonia vaccine, influenza vaccine. Those are things we look at different age groups.
Well, while we should be doing something at different intervals, is there something that all men of any age should do every year?
I think just come get the physical and we'll figure out those details for you. Basically like a template and a checklist we have for different ages that we need to be doing. Healthy lifestyle is the best thing you can do to help your physician keep you healthy and your health team keep you healthy.
And that is again for all ages. I mean, you can eat well in your 20s and take that right into your 70s and 80s, and you might get there a little bit easier if you're eating.
You're exactly right.
And exercising all the way along.
You're exactly right.
Doctor, thank you so much for coming in this morning.
Thank you.
It's so important to stress to men that their health matters.
It does.
Not just to them, but to their families.
Exactly.
And pay attention to it.
Great. Thank you for having me.
Appreciate you being here.